Moses Okoth. I met Dr. Bossi in 2004, and I was working in a pharmacy in Nairobi city, employed in a pharmacy in the town. So I was working there, and Dr. Bossi came to buy some drugs. He was talking to a slum in Nairobi called Kibera. So that's when I came to meet Dr. Alberto, and
he was working with some organization, or
yes, he was working in an organization, and he was taking some medicine to do a medical camp in Kibera. So, and I was selling drugs. So that's when we came to know each other, because I asked him what he was doing, and he explained to me, and I had a little interest. So when he said to me that he's a radiologist, and because we made friends, and asked me if I wanted to learn ultrasound. And when he said that, my mind went back 1 year ago, when my girlfriend then was pregnant, and she had a fibroid, a myoma in the uterus, and she was 4 months pregnant. And we had to go to radiologist in the city all the time to do ecography. And by then, one ecography was around 3,000 Kenya shillings, and that was very expensive for me even to afford.
This is Nairobi.
That is Nairobi. So because of me, when I remembered that incident, the problem I had then, and I spent so much money trying to save the baby, but unfortunately after spending so much money, we lost the baby. So I remembered that incident, and I was very lucky and very happy to get that opportunity from Dr. Bossi to start learning ultrasound, because he said to me he's going to teach me sonogram for free, so that if I learn sonogram for free, I should also try and get 50% of my time or even more, and volunteer to help others if he's going to teach me for free, and I accepted. So since then I started learning ultrasound from Dr. Bossi, and also that incident made me, because I was wondering if I was lucky, my girlfriend was working, I was working, so we could try and pay a little bit, and also with help from my parents. So what if the people who cannot pay totally, who are very poor? So I was touched by that and decided I'm also going to do what Dr. Alberto said, to give 50% of my time as I learn ultrasound to help other people. So that is how I came to volunteer and to learn ultrasound.
I read that you said that the people who look at the ecographies of your wife didn't understand well what was happening. Is that truth?
Yeah, because when we were doing ultrasound is very new in Kenya. Not many people know. We were even taking a report to the doctors, and they could see and they could not understand, because most of them don't have the knowledge of ultrasound. So to get help was from very few doctors who know that, and they are very expensive. So it was difficult for me to afford to get the doctor who knew everything to do with ecography. So however much we tried, it never worked, and we lost the baby.
One have to pay for public health in Kenya.
Yes, in public health is not free. You pay something. For example, the cheapest ultrasound in Kenya is in a public hospital is 1,800 in public hospital. That is the government, and private is between 3,000 to 5,000. And if you take where I'm living in Korogocho, the people someone to pay for 3,000 for an echogram exam is like what they make in 1 month. So you tell someone to do 3 echogram in 1 month, that means he's not going to eat or live or anything for 3 months. So
that means that a lot of people doesn't make ecographies.
So if you send someone to do ecography, they say, now I can do one, but I cannot do the next, because that means you are not going to survive for the next month or something like that, because they make less than $1 in 1 day. So it's difficult for them to take this money and pay for education, or is it to pay for food and where to live, or to pay for one exam. Yes.
What is the work of RHA, Reference Healthcare Organization?
Rehema Healthcare Organization, RHO, started when we met with Dr. Alberto. He said it's better if it starts an organization, a small hospital, just a clinic, a small one, to put up an ultrasound, now to come and to help in diagnosis of patients, because he was teaching me ultrasound, and there's no way I was going to study ultrasound and do practicals. So he teach me ultrasound and I do the practicals at the RHO. Rehema is a Swahili word for mercy. It means to have pity or mercy. So when Dr. Alberto suggested they start this organization to teach ultrasound, so that you can teach other people also in Kenya ultrasound, to get to know this knowledge, so that it cannot only be something luxury for very high people, also for other common people to access the services. So we started this place to put an ultrasound there, and volunteering at the very same place, and we're getting some people to teach, like students, so that they can also learn ultrasound and volunteer to other people. So this center is a place to teach and to also help other people who need to access services of ultrasound.
How is it? Yes.
Yeah, and Rehema Healthcare Organization was started with the help of Dr. Mercedes Barcelona of Africa Digna Foundation. Yeah, she encouraged us to, Dr. Bossi, to come up with a place where it is just established to teach people and also for people to access. So she's the one who suggested that we should, when we came up with the idea, she encouraged us, so that we push on with this idea to make it a place to study. And when we started the organization, she helped us a lot with from Africa Digna Foundation. They're the ones who provided everything to make it start from where it started and up to now. It's because of the help from Africa Digna Foundation. Yes.
How much people benefit from your work?
The most people who benefit from this work, if we try to put it according to gender and need, is pregnant women. Yeah, because there are many cases that need ultrasound, and most of them are usually pregnant women, like in Nairobi, because you find many complications. For example, according to the UNICEF report, they say around almost one person die in Kenya in 1 hour because of childbirth complication. And most of the cases we get is usually emergency and very late cases, where you find there's bleeding, pregnant woman bleeding, and so many other cases. So the main thing is the pregnant women. We get like around 10 to 15 in one day, just pregnant women who come for ultrasound. And most of them are emergency. Then other cases like abdominal, like breast problems, women with fibroids and other complications, or some other diseases like of the liver in men and other people. So, but most of them is women who are pregnant who come to the clinic. So in one day we get around 30 to 40 people who come to the clinic. But unfortunately, most of them is emergency, not the request, because it comes when they're in very critical case and they are rushed to the clinic. So you don't tell someone to start to just asking them, we have to go through this process and this process to get access to treatment. We just do it immediately, find the problem, and if we can help there, but at the moment you cannot do much if there's an emergency. We just do the report and make sure this person goes to the hospital that is going to take care of their needs. So we help in diagnosis, which is very important.